Good afternoon, good people, and thank you so much for attending Bread for the City and Whitman-Walker's Breaking Bread Conversation series. My name is Kimberley Bush, and I am the Executive Director of the DC Center for the LGBT Community, and I will be your moderator for what I expect will be a substantial and vibrant conversation. My pronouns are she, they, and today I'll be joined by a few amazing humans, and we'll be discussing the intersection of sexual orientation, gender identity in regards to health equity. We will also be talking about what health equity looks like and in what direction it is heading. We'll talk about how the community locally and nationally look to advance equity with the current barriers and hurdles that we have before us now. And we'll also talk about how we can amplify our voices and community needs. So now I invite our panelists to introduce themselves and tell us who they are and what brings them to this work. And we can start with Dr. Randi Abramson.
I think we might have lost Dr. Randi, but we can.
Oh, okay. We'll see if we can get her back on. Let's then move on to Dr. Kellan Baker.
Sure. Thank you, Kimberly. Hi, everybody. It's really wonderful to be with you today. My name is Kellan Baker. I use he, him pronouns. I am the Executive Director of Whitman-Walker Institute. The Institute is the research policy and education arm of Whitman-Walker. So we focus on doing the knowledge generation and policy work that supports Whitman-Walker Health's care mission of serving diverse communities across the DC area, with a particular focus on LGBTQ+ folks and people living with HIV. And I do this work, honestly, because a lot of reasons, but just for example, I transitioned in Russia 20 years ago, and it was a lot easier to do that than it is for a lot of trans people in the United States these days to get access to the healthcare that they need. So part of my dedication to this work comes from trying to make sure that everyone has access to the services and supports and protections that they need to thrive.
Thank you, Kellan. Thank you for being here. Let's move on then to Dr. Marla Dean.
Hello, I'm Marla Dean, and I use she, her pronouns. I am actually a little stunned by the comments were just made. If we're behind Russia in supporting people, I don't know what to say. Anyway, moving on from that comment, I just want to say that I am the Senior Director of the Health Equity Fund at the Greater Washington Community Foundation. I'm leading the work there, and our Health Equity Fund has really made a strategic decision that health and wealth are linked in order to really address the health outcomes of communities. Then we need to be addressing the economic mobility of communities and the barriers to economic mobility. So that's kind of the frame of our Health Equity Fund, and that's what brings me here to really say that so much is connected to our financial well-being, that it allows us to be able to take care of ourselves, care for others, be great members of a community and support our communities.
Thank you, Marla, so much for that. Thank you for being with us today. I just wanted to let everyone know if they have any questions, they can definitely drop them in the chat, and we will have plenty of time at the end to be able to address them. So as all of you are aware, June is Pride Month, and we take this time to honor the 1969 Stonewall Uprising. And as we all know, that occurred on June 28th, and it was a time when community members who were patrons of the Stonewall Inn, which was a bar, a New York City bar that was a frequent target of police raids because it did cater to our LGBTQ community members. And at that time, we had enough, and we fought back against police brutality and harassment. And that uprising set in motion a wave of activism amongst LGBTQ community members for many, many more nights after that night, and that spurred the LGBTQ civil rights movement. It's extremely important to center our LGBTQIA+ siblings in the context of the Stonewall Uprising, because even though the gay rights movement, it did predate 1969, the uprising was a catalyst for the modern LGBTQ rights movement and helped fuel the necessary advocacy that we see today. We definitely need to keep in the forefront of our journeys to liberation the fact that we stand on the shoulders of the great humans who fought for our rights and equality. Albeit today, we still have to, do a lot of work to denounce the hate, the violence, and the vitriol that we all face today, and continue to fight and advocate for justice and equality. It's a road that we're all still here trying to pave. But for people who are not familiar with the terms sexual orientation and gender identity, just a little, 101, sexual orientation is a person's identity in relation to gender and genders to which they are emotionally, romantically, or sexually attracted to. And gender identity is pretty much one's inner idea and concept of self as male, female, a blend of both, or neither. And how a person perceives themselves and what they call themselves. And honestly, one person's gender identity can be the same or different from the gender they were assigned at birth. So that's just a little 411 on that. But let's get into some questions for our panelists and start off this great discussion. Marla, I would love to ask you, why do you feel health equity is imperative at the intersections of gender identity, sexual orientation, and race?
So most of us don't realize that non-medical factors account for 80% of an individual's health status, and medical care and access accounts for the other 20%. We often think that this is an issue where we're discussing medical care and access, and actually it is not. We're really discussing the social and structural determinants of health and the barriers to health equity. And so we need to acknowledge that the current systems have created and reinforced persistent health inequities in our city, and BIPOC populations and those who sit at the intersection of race, gender identity, and sexual orientation suffer the brunt of these failures and inequities. And so our vision is to support and advance a sustainable network of people, organizations, projects that leads to a culture of disruption and innovation that will ensure equitable health outcomes for all marginalized populations in DC. And so I think this is what health equity is. This is why it's so important. It is not just about health care. It's not just about health care access. It is about so much more. And it's really about how people are marginalized in community.
Thank you for that, Marla. Kellan, can you share with us, please, how has the Whitman-Walker Institute worked to advance policy, education, and research for the LGBTQIA+ community since its inception? And how is the Institute planning to address the care this community needs with the current political hurdles?
Yeah, we really look at the mission of the Institute very much from the perspective that Dr. Marla brought, which is that it's so important to make sure that people can access healthcare. And at the same time, so much of what is happening for folks is happening outside the clinic. It's happening in our neighborhoods, it's happening in our families and schools and workplaces. And so marrying that population health approach or public health approach that understands all of these different factors with the provision of specific medical care is something that we're really trying to do here at Whitman-Walker, to kind of bring all of these perspectives to bear in order to address not just people's specific healthcare needs, but also these broader factors that are influencing how healthy they're able to be. And so the Whitman-Walker Institute was launched in 2018. Whitman-Walker itself, the federally qualified health center, Whitman-Walker Health, turns 50 this year. I know we don't look a day over 29.
Congratulations.
So Whitman-Walker Health has a long history of providing direct medical services, as well as a wide variety of other services related to medical legal partnerships, for example, making sure that trans people can change their identity documents, helping people apply for asylum, all of these other elements that go into addressing social determinants of health. And we've also always done research and policy and education, but recognizing that when we're a safety net clinic with a frontline care mission like Whitman-Walker Health, it's really hard to sometimes feel like you have the time or the opportunity to pull the camera back a little bit and say, what kind of background work could we be doing to better understand the barriers, better understand what opportunities different communities, different groups of people, patients, families need. And so that's the purpose of the Institute, is to do the research that helps us understand what are those disparities, what are those barriers to good health and high quality healthcare and overall well-being, and then how do we translate those findings into effective policy and education work that helps systems across DC, across the region, and across the country do a better job of serving all of the patients that they work with, all of the people that they work with, and with a particular understanding, as Dr. Marla so eloquently put it, of where sexual orientation and gender identity fit into these considerations of helping us understand that no one person lives in a silo. No community is monolithic. There are so many of us who are living at these intersections and experiencing multiple forces of systemic oppression. And how can we, as a health system, as a public health system, as a society, really intentionally dismantle those systems to make sure that everyone is able to be who they truly are in a community that supports and loves them.
Absolutely.
Doing the integral work that we so desperately need. Both appreciate both of you, Marla and Kellan. And Randi, you're back. Yay.
Sorry about that. Yes.
No worries. Can we just take a moment for you to introduce yourself and tell us a little bit about yourself and what brings you to the work that you do?
Sure. So Randi Abramson, I'm the medical education that bring this together, but we think an organization thinks about poverty and race and quality of life for the residents of the district. And I come with this perspective as a primary care physician. And I really feel that often we are great about siloing different health issues and different populations. And what we're trying to do as a primary care organization is really be very holistic and say, we are here, this is your safe space to really listen and to be open to whatever your issues and your concerns and your questions about your health and yourself are. And I think that's the kind of the perspective we're coming from and what we're hoping to kind of teach our staff and then act as a model to kind of teach other primary care providers that this is the care that we're hoping to give.
Thank you so much, Randi. So let's talk about Marla, about the roles that you think that nonprofits and foundations need to take to address the needs of our LGBTQIA communities and how we all can remain hopeful in this uphill battle that we have before us.
Yes, so I think we need to first just say that achieving health equity requires more than improving the individual health outcomes and expanding access to services. What we have now has been created and shaped by centuries of laws, public policy, behaviors, and practices that have worked together to produce the disparities in outcomes that we see today. So with understanding that, I think it's important that nonprofits should be working together to develop a health equity agenda for the District of Columbia so that we can implement systemic change through legislative, regulatory, and budgetary means. And foundations should be providing funding to support and advance a sustainable network of people, organizations, and projects leading to a culture of disruption and innovation that will create the conditions for equitable outcomes for marginalized populations in the district. And if foundations cannot give general operating dollars, which we know nonprofits prefer and they're the best, at the very least, we should provide flexible funding that demonstrates trust and respects the expertise of the nonprofit community. So these are some of the things that I think nonprofits and foundations should be doing to support this work.
I agree wholeheartedly with you. There's actually a coalition, I don't know if any of you know about it, called the DC LGBTQ plus budget coalition that the DC Center is an active member of. And one of the many things that we do is use our voices and our visibility to fight and advocate for the much needed funding, especially in regards to our marginalized and underrepresented community members, within our own community, funding, for healthcare and health equity, better opportunities, because it all boils down often to funding, and funding that is scarce and funding that we're all trying to go after, but it's all definitely very much so needed to be able to improve the health equity in our community. So I completely co-signed everything that you've said. I'd love to ask Randi and Kellan for their opinions on this one. What role do you feel healthcare providers and agencies can take in the movement to protect transgender people, especially in this political climate? And how are your organizations and agencies, form of care involved to adapt to the needs of the LGBTQIA2S+ community? You're on mute, Randi.
Perfect, thank you. So as a primary care provider in the community that sees a wide variety of people, I think that what we have really tried hard to is remember to not just listen, but I think to ask the probing questions and to make sure people know who walk in our doors that we are open to discussion of if someone is questioning their own gender identity, for instance, that we are there for them, that this is all of a community support that needs to happen. And I think that we have kind of made that shift from someone who just, we are open and willing to listen, to someone who actually signals that we actually want to hear that all of you come into this space. And I think that that is the model that we're trying to create, which is, and then needs to be a kind of explored and expanded, and needs some of that to really reflect kind of, when we think about health equity for the whole community, I think we really need to make sure that it isn't just within the exam room, but really is then talked about, elevated, and then broadened so that the whole community understands this is our community responsibility to support the entire population of the community and be there for everybody.
Yeah, and Whitman-Walker really approaches this from multiple different perspectives. As Dr. Randi was talking about working with people in a clinical setting, Whitman-Walker Health has thousands of transgender patients, and we do a lot of care navigation. We have a specific gender affirming care navigation program that helps people access the healthcare services that they need. And from the Institute's perspective, really kind of echoing back what Dr. Marla was talking about with helping systems, policymakers, the media, the public, understand that gender affirming care is not just a matter of can trans people get access to specific healthcare services. It is actually an economic justice issue. It is actually a racial justice issue. It is actually a reproductive justice issue. What kinds of decisions do we get to make about our own bodies? And how do we make sure that systems are set up to support us and to get us access to the services that we need, rather than having politicians really practicing medicine without a license and trying to stand between doctors and their patients, trying to stand between people in their communities or between parents and their kids. And so at Whitman-Walker Institute, we're actually, and Dr. Marla, I hope I'm allowed to talk about this, a very exciting opportunity that we have thanks to the Greater Washington Community Foundation, which is really looking at DC as a really, it's in many ways, it's a very progressive place. It has a lot of good laws and policies on the books, but there are a lot of gaps when it comes to really understanding the needs of community members and making sure that community members, and particularly from Black and Brown LGBTQ communities, are really involved in our collective political, social mission and agenda setting for DC. So Whitman-Walker Institute is very fortunate to have the opportunity, thanks to that support from the foundation, to bring together a wide range of community groups, including a lot of those folks in the DC, the Budget Coalition, to talk about what does it look like to put together a queer and trans racial and economic justice agenda. DC has done some work, and I think, in many ways, a lot of great work at looking at the needs of LGBTQ people, of looking at the needs of Black and Brown communities. But there's always more to be done along both of those lines. And then really also at their intersection. How do we understand the ways that the challenges that LGBTQ plus people of color are experiencing that are different from people who look like me? How do we make sure that we're really reflecting the true diversity of our communities? And again, looking at the ways that LGBTQ issues are a social justice issue, but they are also racial, economic, and reproductive justice issues, and making sure that we have an agenda for community organizing and policy change that really accurately reflects that and pushes forward to hold DC government accountable for the services and protections and benefits and opportunities that it's providing to our communities.
It is deep and multifaceted. The work is very deep and very multifaceted. And so what that kind of sort of brings this all together, as you were talking about what needs to be done, can we all talk about people across the country, as we all know, who identify as LGBTQ are being targeted with all the recent horrific bills and the harm is being done to our community at large. How can the community members engage locally and nationally to fight for gender and health equity? To share your thoughts on that with the community, please. And any one of you can start with that.
I'll start because Dr. Kellan already kind of gave a little bit of a preview of what I was going to say. So hint, hint, you can make some connections between what he said and what I am saying. I am going to give, I want to give a preview of an announcement we're going to make next week, which is to announce our policy advocacy and system change grant partners. And this marks the largest single grant round in the Community Foundation's 50-year history. And one of our grant partners, Hinton, will develop and operationalize a queer and trans agenda for racial and economic justice. And so what should we be doing? We should be joining these efforts, acting as allies. And if you're a funder, you should be providing resources to support these efforts. Again, I really want to stress that achieving health equity is more than just improving one individual person's health outcomes or expanding access to services. Not that that's not important, that's very important, but it's really looking at the way people have been marginalized on purpose, intentionally, through centuries of laws, public policies, behaviors, and practices that create the outcomes we have. And so I'm just really excited that this is going to be part of the work we're going to be supporting. We think it's incredibly important work, along with other groups we're going to support who are also at the margins of life. And so we're just thankful to our partner who brought this forth and is centering this agenda. We think is absolutely essential. It was it's fine.
Randi,
Kellan? I was going to say, I just wasn't going to be as explicit, but we're good.
I was messaging Dr. Marla saying, oh my goodness, I hope I just, really wanted to shout out the transformational investments that Greater Washington Community Foundation is making in our city. And I think, the mention of the trust in the organizations that are doing the work and really trying to provide those resources while also that, saying here's the opportunity. And it's up to the community and the organizations working together to really figure out where to go with that opportunity and how to make change. And I think that's, one of the I think most challenging things in the US today is just sort of this undervaluing, honestly, of the incredible work that goes on in local areas. Everyone is so focused on 2024 and Congress this and Trump that and whatever. And yes, major change can happen on a national level. And it's really important that we have the right people in power. But it's really about local communities where true change comes from, because we're the ones who understand what our communities are going through, and we're the ones who should be in a position to make the decisions and push forward and organize to hold local government accountable, to hold states accountable when they're trying to take away access to healthcare, for example. And so I think that the work that happens here in DC, I came to DC honestly for a graduate program 15 years ago, and the program was fine, but the city is an incredible place of so many people working their butts off to make this world a better place. And we have so much to do here and so many good opportunities to show other communities around the country what does it look like to really take LGBTQ justice, racial justice, economic justice seriously.
And what I would just add to that is that while this should be led by the people who know the issues the most and the most marginalized, and so from taking it from that Black queer perspective, maybe the best way to take a look at this, but to also bring in us as allies. So those who are of the general community who want to be there to support you, not to lead this effort, but to be your allies, to support it, to really make it truly not just words on a paper or the laws that look good in the books, but really a community shift. And I think that's what we're hoping to do happen in the larger community, and not just make it a little bit better for an individual or a little bit better for one piece of a community, but for the entire community.
Universal, make it universal.
Mm-hmm.
We do have some questions in the chat that I will put out to everyone. So we have, what are some policies we should be focusing on organizing around locally? I think that there's a few things that have been touched on, but if anyone wants to take that.
Recently, I had the pleasure of hearing from Dr. Derek Hamilton of the New School, and he was speaking on a human rights economy. And what he said, what really resonated with me is we should not be pitting policies against each other. When you're talking about a human rights economy, there are a set of policies that must happen. And you can't just say, well, this one, no, it's like a set. And so when we're thinking about what are those sets, like we should be having guaranteed income for our residents, our citizens, our fellow neighbors. No one should not have the income to support themselves and their families, and to really support their mental health and wellness. We know it will reduce stress. We know so much. We also know that, it should be Medicaid or Medicaid. Yes, Medicaid for all, right? I mean, no one should really have to worry about healthcare coverage. This is just basic needs. There are human rights, and our policy should be around a human rights agenda. We know that some people are criminalized for just being who they are, and we need to address the decriminalization of different populations. So, I mean, there's just so many policies, and we need to understand that as a collective, they are creating a human rights kind of agenda, a human rights economy, and that's so important. So I don't think there's one policy. I think there is a set of policies that we need to be working in tandem and working collaboratively to support and to push and to implement and to pass. And even once they're passed, to like really be funded and sustained, because there's a lot of books on the there are a lot of laws on the books that actually don't get supported. And so we have to think about all of those things.
There are several organizations in the community that are working on decrim policy work. So if anyone that's in this, in our talk, just Google decrim in DC, and you can find a large number of organizations that are doing that work. So that's I think one resource, just Google decrim DC. Anyone else like to take on that question before I move on to other questions?
Yeah, I mean, certainly decriminalization of sex work and decriminalization of drugs is something that we do a lot of work here at the Institute. And that's one of the reasons why it's handy for us to be a little bit distinct from Whitman-Walker Health. As we know, the federal government has some specific policies that make it really hard for recipients of federal grants like community health centers to really speak up about all of the challenges that our patients and our communities are encountering. So that's a lot of work that we do here at the Institute, trying to identify those the misuse of the, well, it's not really a justice system, but the use of oppressive tools of the state to criminalize people for living their lives. We also, I think, to echo Dr. Marla, a lot of the things that we think about are some of those leveling the baseline of what everyone is able to access in terms of support and protections. So universal basic income, for example, Dr. Marla mentioned Medicare for all, making it possible for everyone to have access to health insurance coverage so that they can access the healthcare that they need. Working on education to ensure that everyone has access to high quality education that meets them where they are, right? Rather than an expectation that everyone learns in the same way. And I really don't think it's an accident, honestly, that we're in such a tough time in the United States around these attacks on, for example, LGBTQ people, or continuing attacks on Black and Brown people, or on reproductive health and justice, because one of the things that's gone along with that is the erosion of education and sort of pulling away from supporting our young people and making sure that they have the tools and the supports to be who they want to be when they grow up, and kind of hoping that we'll be able to keep everybody in ignorance of how diverse and how awesome and how just different so many people that we all are, and kind of keeping the knowledge of sort of how we as communities can grow and advance and change, keeping that away from our young people. And so I think that the attacks on education are, I look at things like the Don't Say Gay and Trans laws in states across the country, but also just divestment in public education. And I think that that's a really critical social justice issue that needs to be part of all of these conversations as well.
And I just want to add one more that I would add, in a total agreement with the basic things that you just said in terms of income and Medicare for all and education and decriminalization, but also housing. That I think that without seeing housing as a basic right, which just like a basic income needs to happen to everybody, housing is a basic right, healthcare is a basic right, and access to a really good, robust and good and diverse education are just like needs to happen. And there's the, we could do it in the district, but we're just looking, where's the will of those who are in leadership? And so I think that would be the place to kind of push them and make them work.
Housing is huge. The number of housing vouchers that are lacking here in DC, especially for our LGBTQ plus and our LGBTQ elders, is astonishing. Astonishing. So yes, if anyone wants to, and again, one more thing that the DC LGBT Budget Coalition is fighting for, advocating for, directly with City Council, directly with the Mayor's Office and LGBTQ Affairs, housing vouchers are scarce and are desperately needed. So housing, yes, is a huge thing.
Can I just say one thing about education? Because I'm an educator by trade. That's my first vocation. I think we have to be on alert for how these miseducation efforts begin to creep into our society. And so when I think back as an educator, I see a direct connection between the Don't Say Gay that's going on in Florida and other places, and what happened with No Child Left Behind, where they really narrowed the curriculum and really said it's all about math and reading, and did not think that social studies and civics was an important piece of it. And so over time, you see people who really don't have a fundamental understanding of or a critical understanding of our country and its constitution and its history. And it makes it so easy for people to jump on a bandwagon, be ignorant, and say and participate in these absolutely absurd efforts. So I think we just have to be careful about how these things creep into our conversation, into our policy, and how 20 years down the line, the impact it has in such dramatic and devastating ways.
Yeah,
Thank
one
you
of the
for adding that,
things.
Marla. I'm sorry, go ahead, Kellan. No, go ahead, Kellan.
That just sparks sort of one of the things that we're really encountering around gender affirming care, for example, is exactly that. It's disinformation, which isn't just getting things wrong or being confused or whatever. It is weaponized lies that are seeking to masquerade as truth. And there's so much of it happening around gender affirming care. There's so much of it happening around critical race theory. There's so much of it I mean, as you were saying, Dr. Marla, just the basics of what our country is, where it came from, what it has come through, where it is going. And disinformation is this really concerted, intentional effort to lie to people about the realities of life in these United States. And it really does hinder our ability to continue to make progress as a society, because we're so constantly going back to fighting these same old battles of disinformation, of efforts to hide the truth in order to advance this really extremist political agenda that is so bent on attacking all of our communities.
To keep the oppression going.
Before we ask the next question, I just want to highlight that I love that the title of this is about health equity, and yet we are talking about health equity, but we're naming the things that really make us a healthy community. And it's not just about access to care and having health insurance, but it's really about the whole community and the issues that we've raised. So thank you to all of you participants here.
Agreed. We have a question that asks, what are the ways that folks who don't identify as LGBTQIA+ can support the leadership of LGBTQIA+ justice initiatives?
Well, I can just say really quickly, I mean, none of us can do it alone.
Yeah.
No one movement can do it alone, no one organization, and no one person. And I think that that's really something that a lot of us as social justice advocates really struggle with, because we feel that burning drive to make change, and we really want to be present, and sometimes figuring out how to be present, how to support leadership from the most affected community members, while not playing a role that doesn't make sense, that while not stepping into the middle of decision making around decisions that aren't ours to make. And so I think, looking at each of our individual talents, each of our individual things that we can contribute, whether we're really good at writing, whether we're really good at public speaking, whether we happen to have relationships that we can leverage and move information around on the back end, whether we're great in a foundation role, whether we do research, right? There are all kinds of ways, and not just about identity, but about talents, about interests, about what we like to do, and taking sort of clear stock of what we can bring to the fight, identifying where are those voices that we can support and amplify and to help build power, and being ready to move up and move back, and recognizing that it's never going to be, a full throttle this way. It's never going to be a full throttle that way. This is a marathon, not a sprint. And it's actually a relay marathon, right? We're passing the baton from hand to hand, and not just between generations, but between ourselves as community members every day.
Yeah, I would agree with that and build upon it. So Kimberley Crenshaw, who is considered kind of the mother of the term intersectionality, is also one of the pivotal thought leaders in critical race theory. It makes sense. And the reason why critical race theory to me is being such a hot button issue or being made such a hot button issue is because of this concept of interest convergence. And it's really around people coming together, understanding common interests, not being divided in ways that truly only benefit the powerful, the wealthy. And so I think that the way that you do is that you show up, you listen, you learn, you participate, you realize that you don't speak for a community, but you help to support what any particular community thinks is important. And you don't think that what you think is important should supersede what that community thinks is important. And because that happens so often. And I think that's the way you have to show up.
Speaking with the community, not at the community, not thinking, not all for that community, but get into that community and speak up with that community.
Yes.
Agreed, completely. Agreed. We have a couple more questions. How can housing and other justice-focused advocates and organizers make our policy agendas intersectional and intentionally inclusive?
Yeah, so I don't pretend to be a housing policy expert. I have a colleague on our team at the Greater Washington Community Foundation who is the expert. But I mean, I think we need to start off with a basic belief and understanding that housing is a right. It's just a right. And then we need to have a understanding of how certain policies have created segregation and segmentation. And then we need to check our own behavior and make sure we're not engaging in NIMBYism. And so those are just a few of the things that needs to occur. And then we need to be thinking about innovative ways to make sure that everyone can participate in either rental housing, home ownership, cooperative housing, whatever they're interested in participating in. And there's a number of ways that we can go about that. Tax policy, property tax, all of these things really impact who ends up living where and how. And so we need to be aware of the multitudes of things that impact housing. But fundamentally, we have to start with a true belief and commitment to that everyone has a right to housing.
I would add that sometimes building coalitions of people. So if you're in partnership with people, different people who bring that different perspective, then that helps inform what your decision is going to be, what you're going to push for. It also helps build trust. So when someone says, this is important, I need your help on this, then you're just ready to say, yes, what do I need to do? So I think kind of more cooperative coordination and building more partnerships can really make a difference.
Yeah, and to add on to those wonderful ideas, I would just say as well to really name what is at stake and to see the through lines between issues. You know, one of the linkages between, for example, gender affirming care and abortion access, and also I would say housing, is bodily autonomy, the ability to have control over our bodies, to make our own choices about what happens with our bodies. And we need housing to keep those bodies safe and sheltered. We need access to healthcare to make sure those bodies are healthy. We need access to reproductive justice to make sure that we can make those really intensely personal decisions about parenthood and family formation. And so really naming, you know, both logistically speaking, literally showing up at each other's conversations and showing up at forums about not just housing, but also about other, you know, all of these other issues, and listening for those through lines and then talking about them, seeing the ways that these are interrelated struggles, that this is about bodily autonomy It is about our ability to make our own decisions about these really fundamental personal things and carrying that knowledge forward when we're talking about these issues, so that it's not just this thing over here and this thing over here and that thing back there, but they're actually all these intertwined elements and intertwined issues for us to work on in coalition.
Thank you all for those amazing answers. We have one more question. If anyone else has other questions, please feel free to drop them in the chat. The last one I have right now is how does work to support queer folks of color and the work of decriminalizing sex work and poverty intersect?
I mean, I'm going to toss that to Dr. Kellan because he's that's exactly some of the work that he'll be doing in the near future. So I think it's important that we hear from Dr. Kellan.
I mean, I think it starts by acknowledging that these are all the same communities that are at these intersections, both of identity and of being targeted by oppressive state policies and by ways in which laws have left gaps, policies have left gaps that don't meet our community's needs. So I would say one thing, the leadership of queer and trans people of color, what are the challenges that they are identifying as top priorities, and what are the solutions that they want to see? And we're aware, as you noted in your question here, it's very clear that some of those priorities need to be decriminalization of sex work. It needs to be economic justice and addressing poverty. And so identifying then where are the resources that, for example, DC government can or should be putting towards addressing housing issues, can or should be putting towards something like universal basic income to make it possible for people to make their own choices about what kinds of work they're doing in order to keep themselves fed, keep themselves housed, it's not free to be, it's not cheap to be queer, trans, Black, brown, a woman, an immigrant in this country. And so figuring out how to bring all of the representatives of different communities together and really listening to hear, again, not just what are the problems, but what are the solutions that would actually address those problems directly, and how do we get the accountability, the levers of accountability with those who are in charge of distributing resources, making budgets, passing laws, enacting policies. So I think that there's a huge amount of, I know that there's a huge amount of expertise in Black and brown, queer and trans communities here in DC about what the problems are. And not only that, but what the solutions are. And so one of the things that I think folks need is some of those resources to pull our minds back and having to respond to the demands of the moment, to be able to think and to be able to dream and to be able to come up with those solutions that are really going to be impactful. Because that's honestly, that's one of the reasons why we're seeing all of these terrible bills, right, in states across the country, because exhaustion is a tool of political oppression. We are meant to be so tired responding to the constant attacks and keeping ourselves alive, fed, housed, that we don't have time to actually do the work of what health equity, I think at its core is really about, which is imagining, dreaming, what would it look like if we all were safe and well and protected and able to thrive? And so being able to create some of that space where that dreaming can happen, I think is a really critical part of building the policy agenda and building the organizing muscle to get those solutions across the finish line.
I totally agree. And I just would add, we need to also be very mindful of the connection between civil infractions and civil fees and how they lead to criminality of certain populations. We've seen this practice over and over again We saw it with the Black codes, and it just really took civil penalties, made it turn it into criminal penalties for Black people. But we also learned about it again in Ferguson. We found out that so many of the people there had all these like civil infractions turned into criminal infractions. And so what we're saying here is this, the policies have a way of figuring out a way to create a pathway to criminalization for certain populations. And we need to be extremely aware of that and be on high alert and resisting and pushing back on that at every turn.
We're running a little short on time. I am going to take this one last question and then I will turn it back over to Tung and thank all of you for being here. What is the call to action for organizations who seek to be inclusive, safe, affirming places for LGBTQIA+ folks to receive critical services, including healthcare?
So I can start and say, I think the call to action really is conversations like this that bring different groups of people together to hear what people have to say, to build trust and build that bridge so that we are there to support each other, to really move the dial. Because it's not tinkering at the outskirts that's really going to make a difference. It's big things that need to change, and that's going to take all of us together to really make that change.
Yeah, I mean, just picking up on some of the threads that folks have raised in the conversation thus far, especially for healthcare providers, remembering, as Dr. Marla was saying, so much of what matters about health and well-being happens outside of our clinics, happens outside of the hospitals. And so being really clear that, particularly as healthcare providers, we have the ability to describe the real human costs of these systems of inequality and really try to bring that home in a way that people who might not spend as much time thinking about the needs of our communities as we do can actually understand. So I would say, leveraging that degree of authority. I mean, I work with a lot of doctors, right? And Dr. Randi, I'm sure you're familiar with this, but the role that, for example, a doctor can play, or the role that a healthcare organization can play to say, like, look, I see what happens to our communities all the time. It's not abstract. It's real. It's very concrete. And so we, as a society, as a government, need to address it. But I would also say, as part of that recognizing that we don't have all of the answers. I used to be in the field of international development, and I got out of that real quick when I realized the degree to which so much of that work is predicated on what I would call, sort of generically speaking, but white saviorism. The idea that there is this small group of people by dint of skin color or gender or educational privilege or, degrees or credentials on the wall that says, oh, well, I've got the answer to this. And no, it's not any individual organization. It's not any individual leader in a nonprofit organization that has all the answers. It's community working together that has those answers. And so leveraging resources to be a convening space, to be an opportunity for people to come together without needing to be the one who dictates what the agenda is.
And I would just close by saying, be willing to listen, to learn, know when to step back, step up, and know when I think white saviorism is an issue, but I think people try to save people all the time, and we're not here to save people. We're here to support each other. And I think we have to approach it from that standpoint, that we're not the heroes of someone else's lives. We're just at best a mechanism of support in someone else's lives. And so I think we have to approach all this with a degree of humility and understanding that who are going to be the best advocates for anyone's lives are the people most impacted by anything. And so that's what we need to understand.
Facts. I want to say thank you to our amazing panel, Marla, Randi, and Kellan, for all of your effort, all of your energy, and all that you do for our community. We are very grateful to have you in our lives. And thank you to all of our participants who joined us today for this amazing, robust, and informative conversation.